Hello again, everyone. We are here to talk about, again, some of the things that we have to deal with day in and day out that we're annoyed with and we're weary of dealing with.
Exactly.
But again, knowledge is power, and so we're trying to educate you because we can't treat everybody. And so for those people who are all over the world, how to choose the right tool for the job, for your job, for your anatomy, for your challenge, whatever it is. So this video, we're going to talk about InMode Evolve versus Emsculpt versus CoolSculpt, and why we choose to only use radio frequency and heat, and also the right electrical stimulation.
Right.
For helping tighten the muscles. So let's talk first about Evolve, InMode's Evolve, okay, which has, and this is what we use, and the reason we use it is because we can tighten the skin with radio frequency, and that we have other modalities to do that as well with radio frequency, which was also InMode, which is firm and
Forma Plus.
Forma Plus. Exact Forma Plus. They changed that Forma Plus.
Exactly. And that's another thing too. If we're confused by these names, you have to be.
And they want you to be confused by the names.
That's exactly
right. So that they
right.
can introduce something else to you for marketing.
The
which
same
isn't
number,
necessarily better.
The same number of syllables, or they start with the letter F or whatnot, so that you will potentially find their
go
system.
for one thing versus another.
Pixel, Fraxel, all of these things, they're designed for that.
Exactly. So Evolve, you can tighten the skin. You can also melt the fat, okay, because it has a application to do that. And you can also tighten the muscle, because remember, just like we talked about in the face, the bone's thin, everything's thin. Keeping the muscle plump is an important part after babies. As we go down the path of life, part of the problem is our testosterone gets low, our DHEA gets low, our thyroid gets low, and so no matter how much you exercise, it doesn't tighten as well. And also, it's hard sometimes to target all the different areas. And one of the things that the Evolve tone does with a particular sort of electrical impulse, it's like you were doing a huge amount, an exhausting amount of sit-ups, but you can do the entire abdomen and you can optimize your time. So it does quickly what you couldn't do enough sit-ups to
Exactly.
do.
And also too, some of us, me, I don't do sit-ups. Well, I don't, but if I did, I do them wrong anyway. So I'm not working the muscles that I'm supposed to be working. That's part of the problem too.
And you can hurt your back.
Exactly.
And people who have back problems, whatever.
Exactly.
It's an issue. So, but most importantly, so you've got to, when you're tightening the abdomen or the arms or the thighs, you've got to tighten the muscle, the skin, and if you have fat to burn, you've got to burn the fat as well. And what we also often throw in is blowing in carbon dioxide in there, because it turns on the stem cells, so everything that we're doing is going to work infinitely more effectively and efficiently.
Synergy is huge. If you can get those stem cells to turn on by an external device and then add it internally, you're working them from both directions and you are going to see better improvement.
So let's talk about heat versus, in the vein of making the right choices. Neither one of us are any fan of cold, CoolSculpt, and the reason is
fat freezing was the biggest thing for a while, and I mean, for all I know, it still is. We stay away from it. I stay away from it. There are many reasons why, but the main thing is freezing fat is just that. It's freezing. It freezes a block of fat wherever it is on the body or the arm or the thigh or wherever. But the thing is you're freezing vessels, you're freezing fat, you're freezing skin. Nerves, thank you. When you look at the list of potential complications when you sign the consent form or you go over the consent form, some of it talks about paresthesias, nerves that are not working properly.
Damage that you don't feel or you have pain.
Exactly. Lumpiness, asymmetry, all kinds of different things. Distortion. Of
the skin and the abdomen and the fat, because it doesn't effectively, completely smoothly burn the fat, depending on the thickness and how thick the fat is.
And then the machine itself, the attachments that go on you are a confined size, so they're finite in the size that they are. So sure, it may fit here nicely, it may not fit up here quite as nicely or whatever. But I've seen patients
and then you've got parts that come over.
Exactly. Yeah. So it's only targeting what is in that actual little space. Unlike heat, where heat has a dissipation and it will actually expand. Exactly. And it will catch those other areas. Big, huge difference. But when you look at these people that come in and say, hey, I need some help, they take their shirt off and show you what they've got going on, and you start asking questions and they say, hey, I've just spent $5,000 on Emsculpt or whatever, and I'm really kind of disappointed. They're lumpy, they're bumpy, it's asymmetrical.
And the skin
it has laxity to it. So we end up talking about this and trying to come up with a treatment plan that's going to work. And basically it all goes right back to radio frequency.
And heat.
Exactly, because radio frequency and heat is going to target fat and it's going to target the skin. So why go with a different technology for one and then have to go have another technology done to repair or improve the outer area or the skin of that, when you can do it all with radio frequency
and treatments. Also, you don't have to worry about, with heat and radio frequency, you don't have to worry about distorting, scarring. You don't have to worry about, look, the only thing is when anybody comes to have something done, they want this perfect result in one treatment. And technology is only going to do so much. It depends on internally where you are, the skin. So yes, we can tighten it consistently and continually. And also when you have a machine like Evolve, you can do everything at one time. So you can do 30 minutes of the skin tightening, you can do 30 minutes of the muscle tightening, and you can be doing one part with tightening while you're doing the other part with toning, and then you change them. So you can do everything at one time. Now, versus Emsculpt, okay? The problem with Emsculpt, and again, it's huge marketing campaigns, billboards, etc., where people are doing Emsculpt. And the problem with Emsculpt is it's not nearly as strong. So you're not going to get as much tightening of either the skin or the muscle at one time versus doing a better tool for the job, which is Evolve. And so, again, you've got to be knowledgeable about technology. You've got to be knowledgeable about anatomy, the body, how it works, etc. And understanding that there's a certain amount that you can expect to do and achieve at one time.
Right.
And then also with, this is why we care about what internally shape you're in, why we do blood work, why we look at your hormones, why we care what you're doing as far as what you eat, exercise, all the things, your thyroid, etc. And also what shape your skin's in. I mean, one of the things that we do for the skin is we do high dose retinol peels to thicken and tighten and volumize the skin.
Exactly.
Because all the things that you've talked about previously, gravity's working on this, plus it's thinning.
Exactly.
Okay, and sadly that goes from here down as we go down the path of life. But so having the best tool for the job is very important. And then back to the operator,
Exactly. That is again key. There's no question about it. Sure, some of these systems will say, "Yay, come in 10 minutes and you're out of here." You think you're going to throw a swimsuit on and be in Hawaii the next moment? Not the case. There's not a lot of downtime or any downtime with a lot of these procedures, but there isn't an instantaneous improvement always either, or you're going to have it done and tomorrow morning you're ready to go.
Right, because burning fat, when we burn the fat, it takes a good 30 days for the fat cells to release the fat,
Yep.
the lymphatics to take it away, and then look, if you're swollen, if you're not in good shape,
Right.
it takes longer. Doing the muscles, yes, they immediately tighten, but you're not going to have a completely flat stomach immediately over time.
Yeah.
Does it make a huge difference? You've got to do your part as well. And then also with tightening the skin, it takes 3 months.
Absolutely, minimum 3 months.
Minimum 3 months.
Anybody that tells you otherwise, they're not being honest with you, because I mean, every study's shown, I mean, it just is the way it is. It is skin. It's a 90-day turnover, if not longer. And when you're optimizing your health, it's even 90 days. So if you're not optimized, or you're smoking, you're not getting enough sleep, you're eating poorly and so forth, it could take even longer. All of these factors make a difference.
And the other thing that you just reminded me is that what we often do, because look, time is the most expensive commodity nowadays. And so oftentimes we'll come in and be doing a face procedure to people, and we'll have the Evolve. So we're killing a lot of birds with one stone. We're solving a lot of challenges at one time.
Exactly.
And then you have to think about, look, just doing your abdomen, doing your the flank area, doing the legs, etc., and blowing the CO2 in there in order to turn on the stem cells so everything works better. So this is why, again, we're trying to educate you about all the options, why this versus that, what works and why, and how your body works. So you can't have your trust betrayed when you go in and somebody says in 10 minutes,
right,
lunchtime, this or that, you're going to get some miraculous result. It just, the longer you do the Emsculpt, the Evolve, you're going to get more result basically for your investment. But no matter what, the longer they do it, it's just like we've talked about with Forma, some of the facial things. The longer that you do it, the better the result you're going to get. So 10 minutes is not going to do it.
Not at all. And again, it's back to that whole operator-dependent situation. We've had our own patients come to us that live in other countries or out of state who have had to go elsewhere and have made comments, "Well, I had that done, I was about a 10-minute procedure." And we're sometimes mortified by that, because we're looking at it.
We're always mortified by that. Yeah.
It's
always
at least
mortified.
2 hours, maybe
Yeah.
3. So again, it's operator dependent as well. When you go to a place who is results driven, I mean, end of story. If you're
And physiology, knowledgeable,
yes, exactly.
the physiology and all the pieces of the puzzle, and the fact that everything matters internally, externally,
Yep.
skin, technology, operators, etc. And so what we're trying to do is educate you. So again, when you go to other places, you've got the information to ask them, well, why can't we do it longer? Doesn't longer make a better result? So hope this helps. Knowledge is power. Is there anything we
Absolutely.
forgot to talk about here?
No, I think that sums it up pretty well.
Okay, so thank you. Again, hope this helps.